everyone, welcome back to my channel. Okay, are you a nursing student? Are you a professional nurse already practicing? Are you trying to write your examination, NMC UK or ski examination? This video is for you. All right, so today we are going to be doing planning on subdural hematoma. All right, and the first one we have is under subdural hematoma is risk for neurological deterioration. Yes, because when we are assessing this patient, it was showing signs of neurological deterioration, all right, with a total score of 14 out of 15. So we are going to plan on risk for neurological deterioration. That is one. We are not going to plan on pain because those patients is having pain as a result of fall and he hit his back of the head on the floor. So we are going to manage pain because Mr. John was complaining of pain with a pain score of 5 out of 10. All right, so let's start from the first one. Okay, so our nursing problem number one is risk for neurological deterioration with a GCS score of 14 out of 15. All right, Mr. John is at risk of neurological deterioration with a GCS of 14 out of 15. Under the nursing Mr. John will not show any signs of neurological deterioration with a GCS of 15 out of 15 after nursing intervention. Then re-evaluation day, Mr. John is to be re-evaluated today. You write your date. If it's 2020 2025, you put it there. If it's 10/2/2025, you make sure you are putting it there on your answer sheet. Mr. John will be re-evaluated today, 10/2/2025, every 15 minutes, and as clinical condition changes. All right, and then we now move over to E-matter read. Number one is E, explain all aspects of nursing care to John and gain consent for all the nursing intervention. All right, and then M is monitor John's vital observation every 15 minutes using Glasgow scale 2 and then escalate according to NICE policy. All right, then under assessment, assess John's for signs of neurological deterioration such as confusion and escalate accordingly. All right, and then another one under E-matter read is teach. Now you are to reorient John to time, place, and person. Okay, orient John to time, place, and person. All right, then another one you are going to teach is teach John his indication and side effects of his do prescribe medication. All right, and then the next one after teaching is to administer that do prescribe medication. Administer John's do prescribe medication and monitor its effectiveness after 30 minutes of administration. Now you are not going to refer John. The next point is to refer John to neurological team. Refer John to neurological team with his consent. All right, and the next one is to ensure that call bell is closer to John and inform John to make use of the call bell. Okay, inform John to make use of the call bell and ensure it's at his reach. Then remember, if you are not documenting it, you haven't done this. The last one is documentation. Yes, document all care rendered to John with date, time, and sign. That's all. You are done with risk to neurological deterioration. And the next one is pain, as John had a fall. All right, Mr. John is having pain with a pain score of 5 out of 10. Okay, under the nursing M, after saying the nursing problem, the nursing M is the next. Mr. John will show less signs of pain with a pain score less than 3 out of 10 after nursing intervention. All right, the next one is re-evaluation day. Mr. John is to be re-evaluated today, 10/2/2025, every 15 minutes, and as clinical condition changes. All right, then we move over to E-matter read again. E is explain all aspects of nursing care to John and gain consent for all the nursing intervention. Okay, now the next one is monitor. Monitor John's vital observation using the Scocoma scale and escalate according to NICE policy. Yes, because you know you monitor John using neurological charts, okay, and it's been escalated according to NICE policy, not news policy, NICE policy, guys. All right, monitor John's vital observation every 15 minutes and escalate according to NICE policy. The next one is A. Next one is assessment. Assess John's level of pain using pain assessment tool, using universal pain assessment tools. All right, the next one after assessment is you now reduce that pain by giving a diversional therapy or deep breathing exercise. All right, so next one is teach John pain relief techniques such as diversional therapy or deep breathing exercise. Okay, and then the next one after teaching, you are still teaching the medication. Teach John the indication and side effects of his due prescribed medication. All right, the next one is to administer. Administer John's due prescribed medication and monitor its effectiveness after 30 minutes of administration. Okay, and the next is to refer. You refer John to neurological team and pain management team because this patient is having subdural hematoma. You remember to refer him to neurological team and pain management team with his consent. Okay, and after referring John, you inform John to use call bell and make sure he's at his reach. All right, the next one is documentation. Remember to document that. If you did not document it, you did not do it. All right, document all the care rendered to John with date, time, and signature. That is it. We are done. Okay, that is, if you are going to manage confusion, is the same thing with at risk for neurological deterioration. All right, okay, let me manage the confusion to make it 3. All right, now John is having confusion with a GCS score of 14 out of 10. Simple. Oh, sorry guys, out of 15. Let's manage confusion. Okay, John is having confusion with a GCS score of 14 out of 15. Good. Under the M is John will show no signs of confusion with a GCS of 15 out of 15 after nursing intervention. Okay, then under the evaluation, to be re-evaluated today every 15 minutes and as clinical condition changes. All right, and then we now move over to E-matter rate. Now, explain all aspects of care to John and gain consent for all the nursing intervention. Explain all nursing care to John and gain consent for all the nursing intervention. Next one is monitor John's vital observation using Grascocoma tool and escalate according to NICE policy. Okay, and then the next one is, after monitoring, is assessment. Assess John's for signs of confusion. Yes, because when you are doing assessments, you will notice that John is confused. His assessment, you notice that John is confused to time, place, and person. All right, so monitor, assess John's level of confusion to time, place, and person. All right, and then you now teach John by reorient John to time, place, and person. All right, depending on the one that John is confused of. All right, reorient John to time, place, and person. All right, you can as well say you are going to write it on a piece of paper and keep it on the chair for John is in form of reorienting the patient. Okay, and then the next one after that, you teach John the indication and side effects of his due prescribed medication. Next is administer John's due prescribed medication and monitor its effectiveness after 30 minutes of administration. The next one is to refer John to neurological team, which is consents. Okay, and the next one is to inform John to make use of the call bell and ensure that that call bell is at his reach. All right, and the next one is documentation. All right, document all the care, nursing care rendered to John with date, time, and signature. That is all. Stephanie, yeah. All right, so guys, please remember to share this video to nurses and your family and friends that are into this profession. Okay, and then remember to subscribe, comment, share, and like. Nurse Goods, love you guys. Thank you so much for watching my video. Thank you, and I pray that all of you that are going to write your OSCE exam or your professional examination, may God be with you. You are going to pass your exam. Make sure you are watching this video over and over and over again. It's going to help you to solve planning on subdural hematoma. Thank you guys. Thank you.